I have to give a huge nod to our Chief Technology Officer, David Lerner. So he's the brains behind our innovation, which is called UltraTrack. And it's actually a combination of two different techniques of measuring blood flow, and we put them together to address some specific limitations of each. So the first is an impedance technology, where we use electrodes on the skin, much like an EKG. But instead of looking at electrical activity, which is what an EKG does, we're actually looking at the flow of fluid through the body. And so we have electrodes that go across the chest and measure the impedance or the resistance to flow, and then we can sort of back calculate what the patient's blood flow is or what their cardiac output is. And this is a type of technology that's been around for decades, but it's not ever gotten widespread adoption because it's not particularly accurate. It's okay for trending, but it sometimes can get these weird measurements because there might be noise from the patient moving around or things like that, where the absolute value of that cardiac output number is not close enough to the measurement that you would get from putting that catheter in the patient's neck, right? So there's not been enough trust in that measurement. Piece two is a miniature ultrasound device. So ultrasound is known as a way of measuring blood flow. And specifically, we use Doppler ultrasound in this version of UltraTrack. And the problem with ultrasound is usually you're having a tech, a sonographer, or a physician do an assessment with an ultrasound device, with an ultrasound probe. So much like you've seen on, a woman's pregnant belly, but that can be done in all different areas of the body. For example, you can put an ultrasound device on the patient's carotid artery, which is sending blood from the heart up to the brain. So it's a really important artery to be looking at, and you can measure blood flow through that artery. But it's a spot measurement. You're not getting it continuously. And there's a lot of variability depending on the person doing that ultrasound assessment. Now, if we do think about patients with a heart condition, a lot of times those patients will get what's called an echocardiogram or an echo, which is an ultrasound of the heart. And in that case, they're doing all sorts of different measurements, including blood flow. But that takes a trained, physician or a trained sonographer to do that assessment. And that's not always practical if you're in a high stakes critical care environment like the NICU or pediatric ICU. So the ability to measure continuously and without that level of expertise is important. But that's what the impedance device is giving us. And so what UltraTrack does is we use measurements from the impedance device, and then we take some details from an ultrasound, a miniature ultrasound sensor that goes on the patient's carotid artery on their neck and combines the two together. So now we're getting more accurate measurements because of the ultrasound, but we get the continuous measurements because of the impedance.